Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about Proscar. Proscar is a drug that decreases the symptoms associated with benign enlargement of the prostate. It's 5 milligrams of finasteride. It was approved by the Food and Drug Administration in 1992 and went off patent, which means it became cheaper in 2006. And interestingly, a 1 milligram dose of that same medicine, the finasteride, is sold as Propecia. It was originally given marketing approval in 1997, and it went off patent, and the price was reduced in 2013. Now, for benign enlargement of the prostate sits at the base of the bladder, and it becomes enlarged as men grow a little bit older. And as the prostate grows, it impinges on the area of the urethra, and then men develop symptoms of difficulty urinating, typically beginning in their 50s and 60s. Now, in the days before Proscar, that meant an operation, the transurethral resection of the prostate, or the TURP, associated with incontinence, dribbling urine afterward. There were a variety of other operations, laser procedures, or the tuna procedure, all of which had some side effects and inconveniences and costs. What are the symptoms of benign enlargement of the prostate? Well, they involve the increased frequency of having to go to the bathroom to urinate, increased urgency, you got to go right now, the problems with getting up at night to urinate, difficulty starting the stream, straining to start the stream, a weak urinary stream after all of that. Then you dribble at the end of urination and you feel you can't even completely empty your bladder, and then you have to go back to the bathroom within an hour or so and start the whole process again. Well, Proscar improves the symptoms, doesn't completely shrink the prostate, it moderately shrinks the prostate. And with moderate reduction, that's oftentimes all we need. Now, if a man doesn't get complete relief, you can add another medicine, an alpha blocker. An alpha blocker, a drug like Flomax or Uraxatrol or Rapaflo, that works on the smooth muscle. The Proscar works on the glands themselves to shrink the glands. All the Flomax and similar drugs do is they work on the smooth muscle of the prostate. And as they relax the smooth muscle, that takes some of the burden off of the urethra, and it works relatively quickly. And fortunately, the effects are additive with the Proscar. Now, only the Proscar decreases the risk of acute urinary retention, decreases the risk by about 50% at 4 years. The Flomax and other similar drugs don't. And also, it's the Proscar that decreases the risk of surgery by about 50%. How did the whole concept start? It started in 1974 when a doctor from Cornell University presented a paper on intersex Caribbean children. They had sexually ambiguous genitalia at birth. They were raised as girls. But around the time of puberty, they developed a penis, and they developed other male secondary sexual characteristics. These individuals were heterosexual, and it was found that their problem was a deficiency in an enzyme known as 5-alpha reductase. And with low levels of 5-alpha reductase, they were unable to alter testosterone into the active form known as dihydrotestosterone. Well, it was also found that as adults, these individuals had small prostates, which stimulated the interest of the head of basic research at Merck, who said, why don't we develop a pill and we can inhibit the activity of that enzyme, the 5-alpha reductase, and maybe we can improve the symptoms of men as they grow a little bit older. And indeed, that's what happened. And the enzyme is very important. You have to realize that the testes produce testosterone, but that's not the active form. The active form of the hormone is dihydrotestosterone. So to get the testosterone to be converted to dihydrotestosterone, we need that 5-alpha reductase, and that's what's inhibited by the Proscar. Now, there are several different types of 5-alpha reductase. There's the type 1 that's present in the sebaceous glands, the oil glands of the scalp, and it's present in the liver. That's about a third of all of the circulating dihydrotestosterone. Then there's the more important part for us. That's the type 2 enzyme that's present in the prostate and the seminal vesicles and the epididymis, also in the hair follicles and the liver. That's responsible for about 2/3 of the circulating dihydrotestosterone. And finasteride is 100 times more potent here than against the type 1 enzyme. There also is a type 3 enzyme. I'm not too sure about what that does. Research is currently ongoing. Well, finasteride, in other words, functions as an anti-androgen. Now, the DHT is important, of course, especially during the maturation process. It's responsible for secondary sexual characteristics of the testes and the penis and the scrotum and the pelvic and the body hair and enlargement of the prostate. Well, Proscar is going to decrease the dihydrotestosterone, but it's not going to, when given as an adult, affect any of those other characteristics. All you need is a small amount of the Proscar or the finasteride. A dose of 0.2 milligrams is going to decrease the dihydrotestosterone by about 50%. The dose in Propecia decreased it by about 60%, and the dose in Proscar decreased the dihydrotestosterone by about 70%. Now, if we look at the amount of dihydrotestosterone in the prostate gland, we're going to find that Proscar is going to reduce it by about 80 to 90%. That's obviously very substantial. Additionally, there's a little hitch. The testosterone level is going to go up a little bit. It's going to go up by about 10%, but it's still within normal limits. Now, there's another drug, and it's called Avodart. And Avodart inhibits the type 1 and the type 2 enzyme. Remember, Proscar only inhibits the type 2 enzyme. Both of them seem to function equally well. There is no difference clinically in the outcome. Well, what happens to the size of the prostate gland? If you take the Proscar for about 3 months, the size of the prostate gland, the volume of the gland is going to decrease by about 20%. It's going to decrease by about 30% after about 3 years. And fortunately, the portion of the prostate gland that's most affected is the portion right around the urethra. So it's going to increase the urinary flow, and you're going to have sustained benefits over the time that you continue to take the medicine. Now, in a long-term study, it was found on the American Urologic Association prostate questionnaire, the symptoms were decreased by about 3 to 4 points as opposed to placebo, where they were decreased by about 1 point. Now, the scale goes up to 35 points. So it's not a complete elimination. Actually, the Proscar probably won't work in about a quarter of the men, but it will reduce the risk for surgery or the need for surgery by about 50%. It's going to reduce the likelihood of acute urinary retention by more than 50%, and it's going to shrink somewhat the size of the prostate. So in a man, maybe age 60 to 65, the gland might be about 56 cc's, normally less than about 30 cc's. Well, with the treatment, the gland is going to shrink by about 10 cc's. It's going to grow in size by about 10 cc's in men who are not taking the medicine. They did another study, and it's called the Medical Trial of Prostate Symptom Trial, or the MTOP study. And what they did was they evaluated men taking Proscar, men taking one of those alpha blockers, and then men who combined the two. And what they found is that men taking the finasteride or the Proscar by itself reduced the symptoms by about 30%. Men taking the doxazosin, which is one of those alpha blockers, like Flomax, reduced the symptoms by about 50%. Combined the two, reduced the symptoms by over 60%. Now, if you stop taking the Proscar, the benefits are going to go away within the course of a year. Side effects, relatively few. It was thought for a while, well, maybe it would increase the incidence of breast cancer in men. or something of that nature. But it was found that no, indeed, it didn't. But it does cause a small increase in sexual side effects for men. Less than 2% of men going to complain of erectile dysfunction. Some reports go up to 5% or even more. Going to decrease the libido, and again, less than 2% of men. Cause ejaculatory disorders, again, less than 2% of men. Decrease the volume of the ejaculate, again, in a small percentage of men. Well, these sexual side effects tend to develop early in treatment, and even while you continue to take the drug, they seem to disappear. So if men continue to take the drug, and we follow them, say, for 2 to 4 years, there's no difference in the sexual side effects in men taking the Proscar versus men taking a placebo. It's what we call the nocebo effect. You've heard of the placebo effect. This is the opposite, because the men were warned that they might develop some sexual symptoms, so that sort of set them off to thinking about the problem, and indeed, that's what developed. Well, there is some suggestion that maybe the Proscar is going to decrease the sperm mobility, decrease the appearance of the sperm, decrease the count. But those studies were in infertility clinics where men were being evaluated for oligospermia, or decreased number of sperm. In any event, if some problem does develop, it still goes away while men continue their therapy or discontinue. Well, some people got the idea that you could have problems after you stop taking the drug, and that was called the post-finasteride syndrome. And they even had a foundation and a health advocacy group, and they said that, oh my goodness, there are lots of problems associated with Proscar. They even said that the NIH, National Institutes of Health, in 2015 recognized this as a legitimate condition. NIH said, oh no, we didn't. We still don't. There's another kind of a problem with Proscar. If a woman even touches the pill, especially if the pill is broken or crushed, and then the woman becomes pregnant shortly thereafter, or while she's touching the drug, or touches it while she's pregnant, then that might negatively affect the external genitalia of her male fetus. No problem with the female fetus, but with the male fetus, the opening of the penis, instead of being opening of the urethra, instead of being at the tip of the penis, is somewhere along the undershaft of the penis, a condition we call hypospadias. In animals, anywhere between 4 and 100% develop this particular problem. There are also other conditions that develop associated with a pregnant woman carrying a male fetus may develop if she touches the Proscar. So a word of warning. Well, what about a man who's taking the Proscar and he impregnates his wife? Is there an issue? We really don't think so, but there is a question, because in animal studies, there is some of the Proscar that is found in the semen. And for men who would like to donate blood or plasma, it's recommended that they delay their donation for about a month after they stop taking the Proscar. Now, there's another issue, and the issue is prostate cancer. Does Proscar increase the incidence of prostate cancer? There will be about 240,000 cases diagnosed this year. 30,000 men are going to lose their lives because of prostate cancer. And prostate cancer is extraordinarily common, undiagnosed. So it's estimated maybe as many as 50% of men in their 60s or 70s have prostate cancer, never going to be diagnosed. Well, we diagnose prostate cancer typically when the PSA tends to rise. But the Proscar is going to decrease the level of PSA by about 50%, and it achieves that 50% reduction by about 6 months. So is PSA still a legitimate screening test? There's a question about whether it was a screening test at any time, but all we have to do is double the value, and then that would be adequate for screening. Now, there was a study, and it was called the Prostate Cancer Prevention Trial. And it looked at over 18,000 men who, at the beginning of the study, had an average age of about 60, and it followed them for a very long period of time. And the first report came out after 7 years of follow-up, and they found that the total incidence of cancer of the prostate was reduced by about 25%. but the moderate to aggressive cancers were increased by about 1%. Well, that's potentially scary. But they did a 15-year follow-up on the men, and they found that the incidence of prostate cancer was now decreased by 30%, and the likelihood of the moderate to more aggressive cancer of the prostate was basically about the same as in the placebo group. It was only about 0.5% different. And at 10 years, the overall survival was equal, the incidence of low-grade disease was equal, the incidence of high-grade disease was equal, and they did a 25-year follow-up. They presented that at the American Urology Association meeting in May of 2018, and what they showed was that there was no increased risk from dying of prostate cancer. In fact, there was a decreased death rate in men who were taking the finasteride, the Proscar. And not only was there a decreased risk of developing prostate cancer in general, there was no increase in the advanced or the moderate prostate cancer. And even better news yet, the study was not performed by a drug company, so it's unbiased results. It was performed by the federal government. And another study performed in Stockholm, presented at the Journal of the National Cancer Institute in March of 2018, showed that a large number of men, followed for about 8 years, did not have any increase in the incidence of aggressive prostate cancer. And in fact, the total incidence of prostate cancer fell quite dramatically. Now, about the pill, you can take it with or without food. About 2/3 of the substance is going to be absorbed. It's going to have a half-life of 5 or 6 hours in men less than 60 and 8 hours in men over age 70. We know that you're going to have a steady state in the system after you've been taking it for about 2.5 weeks. The metabolism, 60% is going to go out in the stool, 40% is going to go out in the urine. No drug interactions to speak of. You can take it if you happen to have renal disease, but if you have liver disease, it's going to be metabolized in the liver, so you might have to be a little bit careful. You can't overdose on it. The good news is now that it's generic, it's very inexpensive, less than $15 or $20 a month. So as men get older, the prostate is going to enlarge, and as the prostate enlarges, you're going to have some symptoms. And fortunately, we have a variety of medicines, of which Proscar stands out as the #1 drug. And sometimes we have to add to it a drug that's in the alpha blocker family, like Flomax or Uraxatrol. And for the most part, in many men, in the majority of men, we can avoid that operation that had so many problems associated with it. Now, if you want to learn more about using finasteride as Propecia for hair loss, we have another video on it. Thanks for watching. I'm Dr. Ken Landau.